If your vacation looks like a headline, you're in for a story. If your ship logs include the word outbreak, you're not on a normal cruise. When 11 people are sick, public health teams work around the clock to find out why. A recent cruise has become the center of a serious public health investigation after passengers fell ill with a rare but dangerous virus. Here's what you need to know. We'll break down what Hantavirus syndrome is, how it spreads, and what to watch for, without causing alarm. The World Health Organization has confirmed 11 cases of Hantavirus tied to a single cruise ship. This is unusual, as Hantavirus outbreaks are not typically associated with maritime travel. 2. Syndrome, or HPS, is a severe, sometimes fatal, respiratory disease caused by infection with hantaviruses. These viruses are carried by rodents, not people. The primary way people get sick is by breathing in air contaminated with the virus. Unlike the flu, you generally can't catch it from another person. While a strain in South America has shown rare person-to-person transmission, the viruses typically found in North America do not spread this way. The focus remains on environmental exposure. So how does transmission happen? The virus is shed in rodent urine, droppings, and saliva. When these materials are disturbed, tiny droplets containing the virus get into the air, a process called aerosolization. Breathing in these microscopic particles is the main route of infection. On a cruise ship enclosed, poorly ventilated spaces like storage holds are prime locations. Rodents could come aboard with supplies or through mooring lines while docked. Transmission can also occur if you touch a contaminated surface and then touch your eyes, nose, or mouth. This makes ship-wide sanitation, ventilation, and food safety protocols incredibly important. Understanding the symptoms and timeline is crucial. The incubation period, from exposure to illness, is 1 to 8 weeks, but most commonly, 2 to 4 weeks. The illness starts like the flu. Early symptoms include fever, severe muscle aches, especially in the thighs, hips, and back, and intense fatigue. Some people also experience headaches, dizziness, chills, and gastrointestinal problems like nausea, vomiting, and abdominal pain. After a few days, late-stage symptoms appear, and the disease can become life-threatening. A cough develops, and the lungs fill with fluid, causing severe shortness of breath. This is Hantavirus pulmonale syndrome. It can feel like a tight band around your chest, or like you're suffocating. This rapid progression is why seeking immediate medical evaluation is critical if these symptoms appear after a potential exposure. How is HPS diagnosed and treated? Diagnosis begins with clinical suspicion. When a patient presents with these symptoms, a doctor will ask about recent activities and travel. Mentioning you were on a cruise ship involved in an outbreak is vital. Based on this, doctors will run tests. Blood tests can detect viral antibodies, and a chest X-ray can reveal fluid in the lungs. Confirmatory testing is then done by public health labs. There is no specific cure or vaccine for HPS. Treatment is entirely supportive. The key is to recognize the disease early and get the patient into intensive care. In the ICU, care focuses on helping the body fight the infection. This often involves oxygen therapy. In severe cases, patients may need a mechanical ventilator. Doctors also manage fever and monitor organ function. The earlier a patient receives this care, the better their chances of recovery. On board a ship, prevention is a multi-layered effort. The foundation is a robust rodent control program, sealing entry points, effective trapping, and strict sanitation, especially in food areas. When cleaning, crews must use protective gear and follow disinfection protocols to avoid aerosolizing the virus. Myth: seeing one mouse is no big deal. Fact: any sign of rodents on a vessel is a serious issue requiring immediate action. In response